Hello, I'm your host, Dr. Warren Siegel, and welcome to 26 Minutes with Dr. Siegel on the Zormed Show. On this show, we will feature local physicians and healthcare leaders who are experts in their respective fields and who will share their experiences and their wisdom. We will cover a broad range of health-related topics on the show, and today we have Dr. Dan Lasser of South Brooklyn Health. Thank you so much, Dr. Lasser, for coming today.
You're welcome. Happy to be here.
So tell us a little bit about yourself. Where you're from, how did you get here, what do you do?
So yes, I'm New York born. I was born in New York City and have lived here and worked here my entire life, my entire career. I was originally born in Manhattan. I went to medical school also in New York at Mount Sinai School of Medicine. And after completing that and realizing that I wanted to direct my career towards OBGYN, and even at that stage I knew that I wanted to go into the specialty of maternal fetal medicine, I did my residency here in Brooklyn at Maimonides Medical Center. And after completion of the residency, that's when I did my fellowship training, which is the specialty training in the field of maternal fetal medicine, and I completed that at Columbia University. So I spent 12 years at Columbia practicing in maternal fetal medicine as part of their faculty group. During that stage, I also had my own practice in which I took care of high-risk patients and did deliveries within a group. Following that time, the 12 years that I spent at Columbia, I also spent 5 years at New York Hospital Weill Cornell Medical Center as Director of Obstetrical Services. When I finished over there, that's when I came to South Brooklyn Health, New York City Health and Hospitals, and I've been here ever since. So far 11 years, and since I've been here, I've been Director of Maternal Fetal Medicine as well as Director of OBGYN and Ultrasound.
Wow, it's been a long career, and you certainly don't look that old. But I just want to make sure I understand. So OB/GYN is obstetrics and gynecology. So
Right.
obstetrics is the branch of OB/GYN that delivers babies. Gynecology is just women's health.
Women's health, right?
Women's health. I shouldn't say just women's health. It's women's health.
Right.
So when you put it together, do you only deal with pregnant women, or women who are going to get pregnant, or women who were pregnant? Can you explain that? And I'm not sure what the connection is.
Right. In my specialty, it could be any of the ones that you mentioned. So even though most of the time I do take care of women who are pregnant and who may have a problem that arises during their pregnancy, or a pre-existing medical problem, or a past history of problems during pregnancy, I frequently see patients before they get pregnant who have had a problem or who have a medical condition that might cause complications during their pregnancy.
So that's interesting. So that's like really planning ahead for women, right? It sounds like what you're saying is, if I'm a woman, I might go to my primary care internist, but if I'm thinking of getting pregnant, I should see you?
Well, usually a woman would see her OBGYN, her obstetrician gynecologist, and most of the time, the overwhelming majority of the time, things are going to go smoothly, and the care of that woman will be entirely given by her primary obstetrician gynecologist. But if problems arise, if complications develop during the pregnancy, I will often get consulted either by that patient's doctor, sometimes by patients directly themselves, if they want a second opinion or if they have questions about complications that have happened during their pregnancy. Sometimes a patient will be directly referred to me even from the beginning of their pregnancy, because it's known that the condition they've got will lead to potential complications and their care will be transferred.
Wow, this sounds really complicated. So let me back up a little bit. So this show is about being healthy. So if I'm a woman and I'm thinking about becoming pregnant, I'm not pregnant yet, I'm thinking about becoming pregnant, are there things that I could do to be healthier and improve the chances that I'm going to get pregnant?
Definitely.
What are those things?
There are things that we know for sure that have been published in scientific research and journals, and things that are out there in culture that can promote a woman's health who's trying to get pregnant, thinks she will get pregnant in the near future. Some of the most basic things are taking daily doses of multivitamins to keep general health good, to also supplement the requirements that she will need for the developing baby. Very often, a woman will conceive and it's not expected, or the exact moment or timing of the conception is not known. So it's a good idea to be on multivitamins during a period of time, even before expecting to conceive a child.
What do you say to those women who say, listen, I eat healthy, I eat right, I only buy organic things, and is there other things that they can do to be healthy and again, have a healthy pregnancy?
Right. So we do know that folic acid, which is one of the vitamins that's available, that many people take, that's even contained within multivitamins that everyone can buy in the pharmacy. Folic acid is specifically useful during early pregnancy and around the time of conception to prevent a certain type of malformation of the body of the baby. It's a malformation where the bones of the spine are normally supposed to form and close to protect the nerves in the spinal cord. And it's been known for a long time that taking extra folic acid on top of what's contained in multivitamins will prevent that malformation from happening.
So in addition to good nutrition, good sleep hygiene, exercise, all the things that we all know we're supposed to do to be healthy, you're suggesting that women who want to conceive, before they're even pregnant, think about and incorporate multivitamins and folic acid?
Yes.
What about once they're pregnant? You used the term high-risk pregnancy. Isn't all pregnancy high risk?
Well, no, thankfully not. Thankfully, we do know that most women are going to have a smooth pregnancy and delivery and have a healthy child and themselves be healthy and lead a happy life. In some cases, complications can arise, but that fortunately we know how to take care of, how to diagnose, how to take care of, and prevent a lot of the problems that can develop because of certain conditions, either of the mother or of the baby itself.
So let's talk about the mother. What are the common medical problems that might present during pregnancy, and how do we make sure that those are treated appropriately?
Exactly. So very common conditions that women have, either at a young age or that develop over time. One of the most common ones is diabetes. Diabetes is a very common disease, and it does present very well-known complications that can affect either the baby or the mother or both. Diabetic moms definitely need to, when they're preparing for pregnancy, need to make sure that their glucose, their sugar control, is optimal and optimized. They'll often do that in conjunction with their obstetrician gynecologist or with their endocrinologist. It's a very common condition that's known to cause complications. Usually those diabetic moms early will get a consultation with a maternal fetal specialist like me, or their care will be transferred to me for the whole pregnancy. Very important for us to rule out malformations that can happen with the fetus due to the diabetes, and very important for the mother's health condition to be optimal during her pregnancy and for the delivery.
So that's somebody who is a diabetic who then gets pregnant. Are there risks if you don't have diabetes and get pregnant to developing diabetes after?
Yes, we know that approximately 15% of women will develop a form of diabetes that's called gestational diabetes, which is a form of diabetes that only happens during pregnancy due to the pregnancy hormones themselves. We test all women for this condition, and if they do in fact have gestational diabetes, there's a very well-known treatment that usually starts with a specific diet and nutrition counseling, testing of blood sugar during very specific times, and we monitor those pregnancies extra carefully with ultrasound and other tests to make sure the baby stays healthy right through to the time of delivery, or intervene in the case that the baby does not tolerate the pregnancy, and we have many treatments to make sure that the outcome is good.
So besides diabetes, what else do women who are pregnant, what are the other medical conditions that we worry about?
Right. Many women have thyroid gland conditions. It's a very common situation where the thyroid gland either doesn't function enough or functions too actively for good health. Those women are usually on medications already and have treatments ongoing with their health providers. Those conditions do put the woman at risk for such things as delivering too early if the thyroid gland and the hormones are not well controlled, or if the treatment is not adequate, problems with the growth of the baby, and problems with their blood pressure increasing too much during pregnancy.
That's pretty common, right? Isn't it fairly common for women when they're pregnant to have problems with their blood pressures, or is that rare?
Yeah, no, it's not rare at all. That's one of our most common complications that happens during pregnancy. If a woman has high blood pressure before she gets pregnant, it puts her at risk for the blood pressure to get even more out of control during the pregnancy itself. Luckily, we have monitoring for that, we have treatments for that, and we can usually guide the patient to a safe and healthy outcome. But that requires a lot of teamwork and work on the part of the mom herself to take her medications, to monitor her blood pressure, to come to the appointments where we can assess both her health and the baby's health. There is a condition that affects about 12% of all women, where even if they never had high blood pressure before, the blood pressure can get high and even out of control during the later part of pregnancy, and this can become so bad that it threatens the life of the baby and the mom. But luckily we do have treatments for these things as well, and we can guide the patient to a healthy outcome.
Wow, this is scary. When you think of all the things that can go wrong, it's amazing to me that we ever have a healthy mom and a healthy baby. You said teamwork. It sounds like it's a lot of work. Can you tell me a little bit about prenatal care? What does it mean to get into early prenatal care? Because what I'm hearing is you saying that you really need a team working with you to ensure your health and your baby's health. Can you talk about that team? Who's on the team and what do they do?
Definitely. Well, first I just want to say that thankfully most pregnancies do go to a healthy outcome with, and we try not to think of when complications arise during pregnancy. We want to make it a natural process. We want to intervene the least we possibly can. So most of what we call prenatal care is designed to do the least amount of intervention, but catch the patient before they fall, so to speak. In other words, detect problems as early as possible and be able to treat or even prevent those conditions in the first place. So prenatal care basically involves a woman being seen during the early part of her pregnancy, where testing will be done to screen for conditions of the mom that could endanger the baby, or abnormal conditions of the baby that could lead to an unhealthy outcome, a child with problems. The tests are standardized. It's recommended for all patients to go through these tests, and then we discuss the results with the patient. As part of the team, we have nutritionists who can give information and guide the patients on optimal nutrition during the pregnancy. We have other counselors who can aid with all other types of problems, including how to deal with the problems that a woman's going to face in starting a family. Of course, another part of prenatal care involves doing ultrasound, which is also known as sonogram, to monitor the baby's development and growth, and to make sure that the outcomes are good.
That's the second time you've mentioned ultrasounds or sonograms. That's the first baby picture, right? I remember when my kids were in utero. I still have those pictures, although they're getting old.
Right.
That's pretty exciting. What do you look for? I know you're involved in the prenatal ultrasound program. What do you look for on those pictures?
Right. Prenatal ultrasound is one of the most important parts of prenatal care, and it's also one of the most exciting for the patient because they get to see their baby live on the screen as if they're taking a peek inside the womb. And we produce beautiful pictures that, as you know, you can keep for the rest of your life, and as I like to say, and have to explain to somebody, the child, when they finally come, and they'll want to hear the story more than one time. But here we actually have pictures to prove the point. We usually do these ultrasounds for a healthy, uncomplicated pregnancy at 3 different time points. One would be early to, first of all, make sure that the baby is developing right, to make sure that we only have one baby involved. Sometimes we see 2, sometimes we see 3. To make sure that we know the due date and the exact stage of the pregnancy that the woman is at. and to take an early look to make sure there are no abnormalities that we can see in the way the baby's body is being formed.
So let me see if I get this right. So one take-home message here is, in order for a woman to be healthy, they have to exercise, eat right. If they're thinking about getting pregnant, they should consider multivitamins. They should consider adding folic acid to their vitamins. Once they get pregnant, they should go into prenatal care. When should that happen? How early is early?
Right. There's never a too early. When a woman suspects that she's pregnant, is late with her period, or very commonly has done a home pregnancy test or a pregnancy test at the office of her doctor, that's the time to sign up and to start the prenatal care. So it's never too early. In fact, we usually encourage the earlier the better.
That's good. That's good information. I hate to talk about this, but does the age of a woman make a difference in their pregnancy? Is too early? I mean, too young scarier as an obstetrician? Is it what's too late to have children? What do you say to those questions?
Well, I'll start with the too late question. This is an area that's a lot of women today face, because we know that in our society and the world, women are having children for the first time at later ages than, say, their mothers or grandmothers did. And they're also having other children, more children, at a later age. In the past, it was very common to believe that this was a big danger to the mother herself. We now believe that that's not really true, that for the mother herself, mothers can have babies safely during their late 30s, early 40s, late 40s, and now I'm personally taking care of women in their 50s who conceive through artificial reproductive technology, which we also sometimes call in vitro fertilization, and that women can have babies safely even at those ages.
Wow, so it's never too early to get into prenatal care? It's never too late to have babies? Is there a maximum number of kids you should have that's really safe?
Right. Well, that's another question that I think people talk about and have grappled with maybe since the beginning of time. It is true that having many babies, especially past 4 to 5 deliveries, can increase the risk of heavy bleeding during a delivery. But I've known and personally cared for women who've had 6, 8, 10, 12, or sometimes even more children. So I think it's up to each individual person. We respect each person's individuality and right to make decisions for themselves. And my job, I feel, is to back them up and help them in any way I can when they make their own decisions.
That's wonderful. Thank you for sharing that. I hate to ask this question, but unfortunately, some of our viewers may have gotten pregnant and lost the pregnancy. Do you deal with women who have lost children? Do you deal with women who have had a past history of either losing a pregnancy or losing children? And how do you help them move forward?
Right. And that is a common situation, much more common than anyone has ever been led to believe. Still somewhat of a scary subject that most people are unwilling to talk about, which I think harms women more than helps women. And it does, yes, become my job to care for these women, to interact with them, to counsel them, to care for them during the process of their loss, in guiding them also on how to deal with it, trying to detox the situation and understand that even this can be a natural process that can happen to anyone, which is the truth. And but help them also in understanding what could have caused the fetal loss and what lessons could we learn for the future to prevent the problem from happening again.
Wonderful. And I really want to thank you for everything you've taught us today. And thank you for your interest in this show and your desire to become more involved and more educated. I invite all of you to visit our website at www.zurmed.com and check out our tools and connect with us on social media. You can also feel free to call us at 718-510-2103. Please stay well, be safe, and thank you for tuning in. Goodbye.